Let's just get started, and because I know you're short on time. And just first, thank you so much for agreeing to talk to us. I know that over the weekend you mentioned that Louisiana in particular and New York could expect a Pearl Harbor type week. Are we seeing that come to fruition?
Well, we're seeing both of these two areas reaching their peak number of deaths each day, more deaths than previously before. And so it's a somber time. But what I think is important and what people didn't report is that I also said that it was a time for America to come together. We know after Pearl Harbor, the country really galvanized and Rosie the Riveter, people buying bonds, doing their part to really support the effort. And what we really need in New Orleans, in Louisiana, all across the country, is for people to do their part by staying at home. This disease spreads person to person, and the way we defeat it is by creating distance between people. And so we need all of you to do your part. The public truly has the power to change the trajectory of this disease.
We heard Governor Edwards say yesterday two things. First, that we saw our highest number of 24-hour deaths, highest number of deaths in a 24-hour period. But Governor Edwards also said yesterday that he is seeing signs that this might be starting to plateau. Are you seeing that other places? And do you feel that that is the case here in Louisiana?
Well, I want the people of Louisiana to know that when I say that there is a light at the end of the tunnel, I see that based on the data. When you look at South Korea and China, they're actually starting to reopen their economies. When you look at Italy and Spain, they're on the downswing of their cases and of their deaths and of their hospitalizations. And that's coincident with them starting aggressive mitigation efforts and social distancing about a month to 5 weeks ago. We also know that California and New York implemented aggressive and early mitigation, and they were able to flatten their curves. And even in New York and New Jersey and in Louisiana, we're starting to see acceleration rates slow down, which is the first part of flattening your curve. You have to slow down increases, then you level off, then you start to come down. So there is hope, but we know it happens about 3 to 4 weeks after you really start to get aggressive about these efforts. And so it means it's more important than ever for Louisiana to go all in.
Do we really know where we are in that curve because of the number of people that may have this disease that we don't even know about, and the number of people who may have had it that weren't able to be tested on the front end of this?
That's a great question, and it's important to know that this week we will surpass 2 million tests across the country, over 125,000 tests per day. It is increasing rapidly. But to answer your question very directly, there are several different indicators. There's testing, and then there's actually hospitalizations, and then there's people who are dying. And so whether or not we tested, we can still extrapolate based on the number of people who are hospitalized and people who are dying, what the burden is in those communities. And the fact that we're starting to see deaths and hospitalizations level off, slow down a little bit, tells us that we're doing the right things. We'll get to a point where we can do antibody testing and find out who actually had the disease in the community but was asymptomatic. And when we do, we'll actually see the death rate start to come down, because that denominator will actually end up being bigger than what we thought. But the important thing now is following hospitalizations and deaths, and then increasing testing so that we can actually make sure we isolate people who we know we have the disease in the future.
Where are we in that antibody test development? I saw the CDC or the FDA may have given, I guess, preliminary approval to one company to do it. Where are we in the effort to get people's antibodies tested?
Admiral Giroir is our testing czar, and I speak with him every day, and he tells me that he expects it to be increasingly available over the next 30 days, to the point that we can actually use it strategically to help healthcare workers go back to the front lines, to help police officers and first responders know, hey, I got it, I'm immune, I'm safe to go back to the front lines. But it's not going to be the panacea. Right now, we need people to know that we want everyone to act as if they have COVID-19, whether they've been tested or not. And that means making sure you stay at home, making sure you particularly stay away from people who are older, people who have chronic medical conditions like diabetes, heart disease, and lung disease. And an important point I want to bring up here, is that I've been bringing up for weeks, is the fact that the African-American community is set up to be particularly hard hit by this disease, because we know that the African-American community has higher rates of heart disease, lung disease, and diabetes. We also know that it's harder for that community to social distance, because many of those folks live in multi-generational housing. They work in the gig economy or on hourly jobs where they can't telework. And so we want them to be aware that it is even more important in those communities than in other communities that people do the right things, good hand hygiene, good social distancing, staying at home whenever possible.
I think Louisiana is a testament to that.
Indeed, indeed. And Louisianans, they have a long history of really supporting each other and coming together. And that's why you're seeing the curve starting to flatten there, as Governor Edwards has said, because people know, they've been through Katrina, they've been through tragedies before, and they know that what gets you through this is community and each other. And so the federal government will be there to support. The state government will be there to support, but the way we defeat this disease is at the community and at the local level, supporting each other and doing the right things.
I was reading that the coronavirus task force may have some news today about relaxing the restrictions for people who have asymptomatic disease and letting them get back to work sooner. Any word on that and whether or not that's going to happen today?
Well, one of the things that we're constantly looking at is how we can start to transition back to some sense of normalcy, prioritizing first essential workers. We need our food workers to be able to go out there and pack meat in plants and pick fruit. And so we want to figure out how we can get them back to work. Our first responders, our police officers. In New York City, we heard 20% of the New York City police force was out because they were quarantined due to exposures. So we're trying to start with those groups and help them understand how they can safely go back to work while focusing on social distancing, perhaps wearing a mask while they're at work so they don't spread disease to others. And as we experiment in those sorts of situations and follow the data, we will become more informed, and then we'll be able to help other communities understand what they need to do to get back to a sense of normalcy.
Because Louisiana and New Orleans are both on the front end of this, can we expect to see some of those things tested here? The antibody tests, the concern for our first responders, our nurses. We were in a nursing shortage before this even began.
Well, absolutely. The federal government has set up field hospitals there. We've sent testing, drive-through testing help there. We've sent extra military officers and public health service officers. I'm the head of the Public Health Service Commission Corps, 6,500 doctors, nurses, pharmacists, and other health people. And we have several people there on the ground. So we're sending Louisiana help because we know that you all are bearing the brunt of this. And as New York is coming down, our concern is Louisiana, it's Detroit, it's LA, it's Miami. And so I want you to know that we're here to support you, and we're all in this together, but we need each and every one of you to do your part so that we can slow the spread of this disease and not overwhelm our healthcare capacity.
So no specific timeline yet on when some of those decisions might be made about antibody testing and all that?
Not yet, because it's important for people to know that most of the testing capacity lies in the commercial market. When we look at the CDC testing and the state public health lab testing, that is still just about 5 to 10% of our overall testing. Most of our testing capacity has been done by private labs in the commercial sector. And so we're working with them to try to ramp that up. But I want people to know, I've talked to Admiral Giroir. He says that he thinks by the end of April, we should have wider availability of, again, antibody testing and the rapid testing from Abbott. And Louisiana is going to be at the top of our list for getting that, because we know that you all bear a higher burden of disease than other places.
When you talk about the light at the end of the tunnel, what does that look like? What are those trigger points for saying we can start to reopen America?
Fantastic question. And it's important to know that every community is going to be on a different curve. New York's going to be different than California. It's going to be different than New Orleans. It's going to be different than Baton Rouge. But that said, we want to see that we've hit our peak and that cases are consistently coming back down. I'd personally like to see cases coming back down for 2 weeks before you start to reopen, because we know you can get tricked. It can come back down, and then you can have a nursing home outbreak and it can bump back up again with several cases. I also want to make sure we have a wide availability of testing so that we can quickly identify people who have disease. We also want to know from a surveillance perspective how many people in the community are asymptomatic. We want to make sure we have public health capacity so that with like measles and tuberculosis, we don't shut down the community for a case, but it's because we can test, and it's because we have a team of people who can go out and find those individuals who tested positive, talk to all the people who they've been around and make sure they're isolated so that one case doesn't become 10, 100, 1,000 cases. And so once we feel that we can do those things, and some communities are already doing this, Montana, Idaho, New Hampshire, and Vermont are seeing low levels of cases, but they're doing surveillance and aggressive case contact tracing. We're already doing this in parts of the country. We hope to be able to do this in Louisiana, but the first thing is to get those cases to level off and start to come back down, and that relies on people following the 30-day guidelines that we have to slow the spread of this disease in Louisiana.
Talk about the masks. I know the masks have been controversial in some communities. You mentioned the African-American community. I know that there are some concerns among some about wearing masks. Can you talk about why it's important when virus can still get through that fabric?
Well, it's important for people to know that you're wearing your mask to protect me, and I'm wearing my mask to protect you. We've always recommended that people who had symptoms, who were suspected of having COVID or were COVID positive, wear a mask to protect other people from them. What we found out now is that 25 to 50% of people out there can spread the disease before they have symptoms. That's new. So we changed our recommendation to say that if you're going to be out in public, if you're going to be closer than 6 feet to your neighbor, that we recommend that you wear a cloth facial covering to protect other people. I know I'm a Black man. I've grown up with racial profiling. I've grown up fearful of people thinking that I'm doing something nefarious. So I understand that a lot of people in the Black community are concerned about wearing a mask. And that's something that we're actively trying to address with law enforcement and with other people out there so that people feel safe to do the right thing. And if you are going to wear a mask, and I actually have my homemade one that I made right here in about 5 minutes with the back of a t-shirt. Mm-hmm. Important to know that number one, wash your hands, because you don't want to put on a clean mask with dirty hands and touch your face, or you could be bringing COVID to your face. Make sure you don't touch your face while you're wearing the mask. Make sure you don't use medical masks, N95s or a surgical mask if at all possible, because we want to save those for the healthcare workers. And a cloth facial covering works just as good to prevent you from spreading disease. And then finally, this is not a substitute for social distancing. Because you're wearing one of these doesn't mean that you can now go out and play basketball or be in close quarters with other people. The most important thing you can do is still maintaining 6 feet of distance between you and your neighbor so that disease can't get from them to you or from you to them.
Last one. I'm sure you guys are gonna, I know you have to go pretty quickly, but talk about PPE and where we are as a nation. I know that it's still a very big concern for our healthcare workers here in Louisiana, even though the federal government has sent quite a bit of resources down here to help, they're still struggling with it. Where are we in terms of protecting those people who need to be on the front lines?
Well, personal protective equipment, masks, gloves, gowns, we're better than what we were, but we're nowhere where we want to be. We're not out of the woods. One of the big problems is there's a severe mismatch at the local level. So we're bringing PPE in from China. We've increased PPE production in the United States. We send it to the states. We're also pumping it into the market. But I'll be the first to admit, I hear stories all the time about it not making it to the frontline workers who need it the most. And so now we're actively working with governors at a local level to help them redistribute that PPE from places of low burden areas to places of high burden areas. We're also calling on local communities to come together. Hey, if you're in a place that has few to no cases, don't hoard the PPE. Make sure you're sharing it with your neighbors in New Orleans and in Baton Rouge, where we know people are getting harder hit. And so I still practice. I'm an anesthesiologist. I still practice at Walter Reed Medical Center. And I want you to know that I very much feel for my colleagues and want them to be safe. We're doing everything we can from a federal level. But again, we need people at a local level to do the right thing, to not use medical masks if you don't need them, to avoid elective procedures for the time being, because that uses up PPE. And the most important thing, and I hate to keep coming back to this, but it's stay at home. The best way to make sure a healthcare provider isn't using up PPE is to make sure they don't have 100 people that they've got to take care of who are COVID positive. And the way we make sure we don't have an inordinate amount of people who are COVID positive is with social distancing and with staying at home. So the number one way we can't treat our way out of this problem. We can't supply our way out of this problem. We have to prevent our way out of this problem by stopping the spread.
Okay, one more, I lied. Chloroquine and the malaria drug that we've heard President Trump talk about over and over again. I know that it's being tested for patients here in the New Orleans area. What are we seeing scientifically? Is it actually working, and when will we know if it's actually working?
Hydroxychloroquine is a malaria drug that's been used for decades, so we feel better about its safety than we do about a completely novel drug. It hasn't been proven to be effective in the treatment of COVID-19, but there are some powerful stories, some powerful accounts, and some early studies from other countries that suggest it may be effective. And so we issued an emergency use authorization to allow that to be utilized if a physician decides that I want to give this to my patients. So 80% of people who go on ventilators, unfortunately, based on the New York data, aren't coming off. And we want to give every single patient the opportunity to have a conversation with their provider about ways that they can be safer, potentially, about treatments that they can potentially utilize. And we're also collecting data, and we're doing that in New Orleans to make sure we can very quickly adjust course if we find out that this medication is unsafe in this new population or if it's not effective.
Any idea when we should know some of those results?
We're hoping that within weeks to months, we will have a little bit more to be able to say with certainty on this topic. But again, we don't want to wait for that data before we give people every possible chance to be able to treat their COVID. And that's why we've made it available.
Okay. Well, unless there's anything else you want to add, that's it for me. And I can't thank you enough for doing this interview and taking the time to speak to people in New Orleans. I know it is certainly a difficult time here.
Absolutely. Well, I was in New Orleans a month ago visiting with Governor Bell Edwards. I visited with folks in Baton Rouge and in New Orleans. And I know the people there will come together. They already are doing the right things. It's important to know that we'll have a vaccine hopefully next year. Within weeks to months, we'll have better ideas about therapeutics. But right now, the most important thing for people to do is to stay at home, to social distance, to follow the 30-day guidelines, because that's what's going to help us stop the spread of this deadly disease.